Just want to thank everybody again. My name is Miles Murphy. I am the Academic and Industry Relations Manager for Aspen Dental Management. This pretty much is an Ask Me Anything, right? So it's called an Ask Me Anything. So you guys can feel free to ask me any question that you want. I will be the moderator. So I will be relaying the message to Dr. Shin. If you see me looking over out of my other screen, that just means that the questions that are currently coming in, I'm going to be looking at them and then asking the questions to Dr. Shin. The question box is on the bottom of your screen. So feel free to ask any question that comes top of mind. And I'm also going to circle back to some of the questions that were asked beforehand, because when the students were able to sign up, they asked questions in the question box once they got the confirmation email. So I'll be circling back to those questions as well. And I also want to say that we are offering free CE courses as well. All you have to do is go to aspendentalce.com/welcome. All you have to do is go into that website, create a username and password. You'll have your profile set, and then you can dive into some of those courses. So I just want to thank you, Dr. Shin, again for joining. He's one of our newer docs. He just graduated in 2020. And without further ado, I'm going to let him introduce himself, and then we're going to go ahead and dive into some of these questions.
Hello, my name is Luke Shin. I just graduated from University of Maryland College of Dental Surgery, 2020, through pandemic. And I actually joined Aspen Dental earlier before my graduation with my connection with the practice owner of Maryland offices. So I have been shadowing and training through the Maryland office of the United States. And then my official date with my schedule coming up is next Monday. And welcome, you're welcome to ask me any questions about how new grad decides to join Aspen Dental.
Great. Thank you, Dr. Shin. So that's actually going to be our first question. So graduating from the University of Maryland Dental School in 2020, this year, why did you choose Aspen? What was some of the deciding factors on why you chose us?
So I actually had, during my college times, I actually worked full-time job through the summer a few times. And then that kind of translated me that I would like to join the workforce as soon as I am done with school, including dental school. And I really did not want to do GPR AGD at the moment of my decision in 2019 when everybody's applying to residency program. Is because I just didn't feel the need. And it really depends on the individual basis and how comfortable you feel. But I was ready to be able to see the patients, and I thought that I gained some experience outside of just dental school. I shared a bunch of different practice models, including individual private practices and Heartland Dental and also Aspen Dental. And I was able to talk with the practice owner, Dr. Gupta of Maryland, in 2019 December. And then right around that time, I actually had a good conversation with not just him, but other practice owners and associate dentists at Aspen Dental. And I did not feel like I was ready to tackle on the private practice of current situation, because the business side of things and insurance policies and everything, I was not really educated in dental school, which is kind of unfortunate. In some instances, they don't really have that education part of their tuition. So I didn't feel like I want to join the private practice. I want to join some sort of supported organization. And I shadowed Aspen Dental early on, and I liked what I saw. The fact was that I wanted to be able to practice dentistry without really concerning myself with the finance part for the patients. I wanted to offer the best treatment plan I can offer for the patient. And also I want to have some sort of foundation support with other practicing dentists in the practice without left like I am alone, which tended to happen when you join smaller private practice. So that kind of worked for me. and I signed with Dr. Gupta, and I waited through my immigration process because I'm an immigrant, and it worked out. So like, I'm just happy with the decision I made. And then the training I've gone through has been very supportive to me as a new grad. So that was my thinking process through since last year, why I decided to join the Aspen Dental.
That's great. Thank you, Dr. Shin. And I love that answer. And I mean, just to kind of transition from that, I did say in the beginning that I work for Aspen Dental Management. So we're the dental support, we're a DSO. So DSO is a dental support organization that, as Dr. Shin said, just shows that support. It gives that support to all of our Aspen Dental offices in the network. We have over 850 offices in the Aspen Dental network, and we give that management and that business to support to all of our doctors and all of our owners. I just want to mention that all of our practices are owned by doctors. So we're just a built-in consulting partner that offers every type of support that they need. From an operations standpoint, from a financial standpoint, technology, from a marketing standpoint, recruiting. So if you're worried about getting patients in the door, we help you with that. Everything that goes into owning your own practice and owning a business, we're that partner, we're that consultant that helps you. So I love that Dr. Shin mentioned that he chose Aspen Dental because of that. That was one of the reasons why he chose. And I just want to let all the students know that is what a DSO is. The DSO is that dental support organization that offers the support to all of our practice owners. So thank you, Dr. Shin, for that answer. So yeah, when you were in dental school and you decided you chose Aspen Dental, what was pretty much the difference between a private practice and the DSO route? I know that you have friends and you have doctors that you know in the industry that chose the private practice route. What would you say is the biggest difference?
The biggest difference I see the DSO versus private practice is that the private practice tended to have one practice owner with maybe small amounts of offices under their name. And you will take on a column of patients as normally an associate do. And you will be promised mentorship, or you pretty much have to figure out on your own, or some level of support will be there, I'm pretty sure. It's just that the big difference is that I think is a huge number of supporters that are around me will be at the DSO. And like I was telling the students earlier, is that in normally dental educations, many US dental schools do not have dental business classes or management classes. So if you are joining as an associate without those skills that you learned through the dental school, it's kind of difficult, and it's on you to be able to manage that on your own. And then even if you're an associate, you have to be able to have a leadership skill to lead assistants, hygienists, and schedulers and office managers. And you also have to figure out your own insurance situations. And there are a lot of good benefits. I feel like I don't have to worry about if I'm in DSO. So private practices, they might not have those benefits. They might not have those large support group. So that would be the huge difference. And also what I like about Aspen Dental is that I studied the business model, and their business model is actually very viable because of I looked at the production collection, how they manage the patients and everything. It seems to me that it makes sense to me that as a dentist, I don't have to worry about concern myself with all this other auxiliary stuff, while I can actually practice dentistry without concerning myself too much with the smaller things. And I really needed that as a new grad, because I did not want to be overwhelmed with other side tracks, things I have to figure out on my own. And then now that I'm with the other 20-something dentists in one huge group of Dr. Gupta's practices, that I can ask any questions, and I'm not left alone. And then it's hard, especially in pandemic setting, that I actually love the fact that I decided to join Aspen Dental, especially during pandemic as a new grad, because private practices as a practice owner, it'd be very difficult for them to take care of their associates in situation because there's a lot of financial hardships. So, and now that I am surrounded by other general dentists and even oral surgeons and endodontists in the team, and also I have the staff members I can always ask questions about, I think that would be the huge difference, that I feel supported. That was the important part for me as a new grad.
Yeah, that's great that you mentioned that, like the support. And I just want to kind of piggyback on what you said, is just being in this role, being an academic relations manager and building the relationship with students. When I have conversations with them, a lot of them are scared, right? They're scared that they don't have that support and quote unquote being thrown into the fire. So it's good because they're not fully comfortable with certain procedures yet, or especially if you don't go to residency, you're never 100% comfortable, right? So it's good that Aspen Dental offers that support when you're a new grad, because that is something that's important to all the students, especially when they graduate and especially when they first get their license. And questions just came in that kind of transitions to that question is, so when you were in dental school, mentorship important to you?
Yeah, so mentorship was actually very important. I think everybody should look into the mentorships. And then because when you are a young dentist, it's very important that what is going on outside of dental school. Because if you do not have a mentor outside of dental school, it's a very tricky to manage that trend of and waves of new dentistry. And it's very important to me, and I still think that as I move along with my career, I will have a different types of mentors. But currently I do have a lot of mentors in my group chat because they all connected me through this WhatsApp app, so I can ask any questions. And then we have some associates working in our offices, they're like fresh 1 or 2 years out, and they still ask questions because you will never run out of questions when you're practicing real world dentistry. And then they will get answers, they will get support system, they will get the okay, look into the C courses, or do you want to learn more about it? I can always talk with you on the phone later. There are support system mentors there, so that's why one of the factors I chose is because I, like Miles was saying, I did not want to be thrown into the fire of the private practice. But you have to make that transition at some point because you're going to be working as a dentist, and most of us are going to be general dentists. So, and then instead of me trying to push my way through the private practice, I wanted to join the DSO just so that I can have breathing room where I can build my skills and then make network and connections and learn about business while I'm actually doing my clinical work without much pressure about business side. So that's why the mentorship is important. And I think if you are not looking for mentorship, I think that I recommend you to reach out to people and then trying to explore your options, whether that's going to be DSO private practices, so that you can get the real world dentistry exposure and then learn from them. So that's why it's very important to me, because it made me satisfied with my decision. Yeah.
Yeah, that's great. We actually have a question that just came in. I'm gonna save that for a little bit later because we have some other questions that I want to get to that kind of relatable to some of the questions that you've answered already. So I know that you mentioned you chose Aspen Dental because the business side of it. So you have the DSO to give you that support, and you can kind of wake up in the morning and go into the office and focus solely on dentistry because that's what you went to dental school for, is to help patients, right? So do you ever want to be an owner, whether it's within Aspen, whether it's somewhere else? Is that your ultimate goal?
So my ultimate goal is I want to be a practice owner. And the thing is, though, my main focus right now is building my clinical skills. And I think a lot of young dentists should be able to do that with this support. But also with that support, you can explore the business and production, all of that like by talking to the managers, talking to the business side of the Aspen Dental, they can always answer your questions about how they run this, and what is the business model is about. So like, I think that that's another thing, is that I can focus on my clinical part if I want to, all I want, but I can always ask questions within the system. So I am still learning from my operations manager, and he looks at our numbers, he looks at business side of things, and I can always text and ask him like, so I'm thinking about becoming a lead dentist, I'm thinking about becoming a practice owner someday, but I just want to have some conversation about you, how that would be possible, and then what kind of business side of things should I learn from you and other people. So that's the thing, is that I can always be versatile. But my main focus right now is that as a new grad dentist, I need to learn more about clinical side of things. And I know my places. I am not a know-it-all dentist that can do every single procedure well. So, and I can do that. But later on time, I'm also going to learn from these pros about, how business works and what is the model like.
No, that's great. And when I speak to all, whether they're students or new grads or fairly new grads, that they all say that their ultimate goal is to own their own practice one day. And it's great that you say that. That's why you chose Aspen, is because you get to learn, you get to focus on dentistry. You get to help patients. Plus, you have your operations manager, you have your director to kind of help you with the business side of things, whether it's metrics. And all that good stuff. So it's good to kind of step into the office and, practice dentistry, but then also learn from the business standpoint as well. So one of our questions that came in fairly recently was, so you currently said that you're shadowing an office, right? So we're going to ask you, what does that look like right now? How does your transition from dental school to being Aspen, signing with us, and being in the office and training right now? So you're shadowing, you're training your lead dentist, and you're kind of getting acclimated to what an everyday looks like, right? So what does that look like for you? What has been going on during this process?
So it's actually quite straightforward. It's not that complicated. So that I have all of my credentials processed by the credential specialist that will look at my license, my like a medication, like administration, and all of that will be taken care of by being assigned to the specialist. And they will enroll me into the system. They look at my credentials to verify that I am bona fide dentist that graduated from the US Dental School. And I passed all of my board exams, including CDC ADAX from my school. And I am able to practice in the state. And then that's taken care of by a specialist. And then while I'm waiting for that, I will be assigned to a practice location. So it really depends on where the need is. And then also they can try to accommodate you with your location. I was very fortunate to be, accommodated to go to most nearest location, and I can just start there. And I show up, and then I, log in and all that, and then I will be shadowing lead dentist. So MCD is the term that we use in Aspen Dental. That is a lead dentist, and they have more experiences than I do. And then I will shadow them, so they will show me how they do treatment planning. They will show me how they read and modify their, records, and then they will show me what kind of procedures they do. And then I can always ask questions about what is your daily schedule look like, and what are the needs in this demographics, and then how do you handle cases like this. And then I spend good amount of time with them, and then they can always assign me to smaller tasks. So for example, I help with fine impressions, and I will do temporizing material, restorations, and temp the crowns just for a little bit, so I get my feet wet. So they don't throw you into the rigorous schedule right away. They want you to be acclimated into the system and then the workforce, so that you don't feel overwhelmed at the beginning. And of course you get paid for those hours. But you show up, you put your work in, you show willingness to learn, and then they will say that I think you're ready to have your own column. And then the office manager will schedule patients for your column, and then you start seeing patients every day. So that is yet to happen, but I was told that it will happen soon for me. And then you pretty much go from there. And then if you want, you can take over more cases, procedures, new patients. And then for me, I don't know if it's just for every single associate now, but they will have me started on Invisalign training. They will also enroll me for the implant restoration by Nobel Biocare implant restoration training right away, so that I can start doing all this restoration and Invisalign orthodontic care. Some of these things I'm very excited about, so that but at the beginning, you will be make sure that you're comfortable and you're not thrown into the rigorous schedule, that you make your own schedule as you go. But at the beginning, they want you to be comfortable in the work environment.
No, that's great that you meant. Thank you, Dr. Shannon. That's great that you mentioned that, because that's a lot of the students' fear is, like I said previously, that they don't have that support and they're just gonna, go from zero to helping, 10, 15, 20 patients a day. And that's not the case, because you're gonna have that support and you're gonna be able to operate on your own speed and kind of build your schedule from the ground up. I kind of want to transition that question kind of it's like I want to just ask a question that's a little similar to that regarding treatment planning. So you did mention your schedule, and you are going to be basically once you learn from your MCD, you'll be able to kind of work your own schedule from there. So are you able to create your own treatment planning? What does that look like? Or do you have any help from your MCD? Or do you have full autonomy? What does that look like for you?
So there will be a supervising dentist that I can always ask about the treatment planning if I'm stuck. And then also this is the philosophy I learned from dental professors, that every single mouth is different, so you have to treat it very differently. And then it comes with your experience. I was fortunate to be on externship sites where I actually had a very complex procedures to be planned out, because it's not just about teeth. You have to, incorporate their dental habits, health habits, health concerns, the medical concerns. You have to really incorporate all that to be able to make the comprehensive treatment plan that patient, first of all, is agreed to follow, and patient also can follow. And then follow through until the end. And then so it was very fascinating to see my lead dentist being able to do that in like 20 minutes. Usually in dental school, we spend days trying to come up with the treatment plan that works for this patient, and then you get graded by it. But but it's good to have that experienced dentist in the office when you're not associated. So when I have my new patient come in for comprehensive evaluation, they have all of their necessary examination done by X-ray and also my clinical examination, and then have a conversation with them. And then by seeing them evaluate their whole history and situation, I think that now I feel more comfortable being able to tackle some of these cases with services we can offer. Some services, if they need those, let's say the complex endo, I can always refer them to endodontists. If I need patient to be, relaxed because they're really nervous to see dentists, we do offer sedations in the practice as well. So there are many things to consider, but it comes down to one thing. It's on your best ability. And then with your good clinical reasoning, you can always come up with your own treatment plan. And if you feel like this is not something I want to be able to manage, then you can always talk to the lead dentist. And then also, it's fortunate to have some of these lead dentists that can understand the reasoning behind it. And also another thing I want to talk about is that over-treating is something of a bad rep among DSOs in the history of being taught in dental school. But I didn't see that happening when I was shadowing there. And also everybody's philosophy and everybody's treatment is a little different. But I think that if it works for the patient wants it, and then it is the treatment that is best for the patient, you treatment plan it, and then office will support you to deliver the treatment.
Yeah, that's great. And I once heard from a doc that you can put 3 docs in office and they'll give you 6 different treatment plans, because it's like an art. So you're never gonna have the same treatment plan, and it's great that you have that autonomy to kind of give your point of view and do it on your best ability. And I like that you also mentioned the overtreating kind of perception, because that is something that I hear all the time from students, not just students, but experienced doctors as well, is that there's this perception with Aspen, with DSOs, that you know, there's overtreatment, there's quotas, there's goals and things like that. But it's great to kind of hear it from one of our doctors that's actually living it and that's actually hands-on in an office, that it's just solely based off of your judgment, and you have full autonomy to create your own treatment plans. And I like that you kind of, you know, debunk that myth a little bit. So that transitions to our next question regarding, you know, your current day-to-day. So how does life been different as a new dentist during this pandemic? I can obviously, you know, imagine that it's completely different, with like the social distancing and, you know, the precautions and things like that. So what does your day-to-day look like with this pandemic, and how is it different from maybe how things used to be? I know that you're fairly new and you're a new grad, but what's the difference there?
So I don't really see a giant differences like between like pre and post, but one thing I can tell you is that the like all of the doctors would treat all the patients as if they're positive for pandemic. So that's the good precaution to approach. So like, you know, and also dental industries and dentistry has evolved to, you know, since this is not the first epidemic or pandemic we had, and then, you know, and then we come up with the PPEs and everything. And I also don't want you to be worried because, you know, like Aspen Dental at DSO, we never really ran out of PPEs. I have an N95 to use like for month and month and month. And then I have a N95 that's fitted by my face, so that I use that if I have to use face shields, I have that as well. So like procedural wise, I don't really see difference. It's just that about management from the front desk to the operating room. So like, you know, when they come in and then they show symptoms, like they will tell them to reschedule. So there are precautions in the place, but in terms of doing dentistry and doing examinations, I don't really see any huge differences.
Great. Thank you, doctor. So this is a question that just got in, and I think this is a really interesting question, because we'll get some different point of views on it. But I can imagine it's something that all the students are going through, whatever year they're in, whether they're D1, D2, D3, D4. This is something that they do think about. So what is the best advice for, in your opinion, managing finances and debt at a dental school? I know it's one of the students' biggest fears coming from dental school. Dental school can be quite expensive. So what would be your advice on kind of managing that after graduation?
So it really depends what kind of loan you have. If you're government or you have a private sector loans, and the approach can be different. But overall, I would say that you're like trying to minimize your extra spending in dental school. That's very important. Try not to travel too much on the loan money. And I would say that the thing about it is that even if you join dental world, it is expensive. If you open up the practice, you have to take a loan for that. If you get a car, you have to get a loan for that. But I would say the education is worth it. The degree is worth it. You will be able to, you know, pay back. And then I know that currently the US government allowed the loans to not accrue any interest until end of this year. But, you know, beyond that, we don't know yet. So I want you to treat your loans like, okay, this is for me to use to get educated, and then learn as much as you can. And, you know, that's the basic principle right now for any dental students. It is costly to go to dental school. It is costly to be a dentist. But if you can manage your finances with the help of other people, that's another mentorship thing comes from, is that you can always reach out to your mentors, like, how did you manage your loans? You know, what was the spending report that you made for yourself during dental school? You can always, you know, try to follow that so you don't spend as much as, you know, that you would. And also, like, I know that, you know, I am going, because I'm an immigrant, so that I do have some private loans, and then I will be refinancing it to lower my interest rate. And Aspen actually has a good contract with a refinancing company, so I'm going to be going through that route to refinance my loans to lower the interest rate. And it is going to be manageable. And then just also be humble. I would say is that a lot of times people come to dental school and like, oh, we're gonna be a ballers, we're gonna be able to, you know, do all that, but it's not a reality for everyone unless your parents pay for everything for you. So just treat it as if, like, okay, I'm getting a degree to be able to work, and I'm gonna be smart about it. And then when you start working, trying to find a good financial planner, you know, and Aspen offers that too if you join the Aspen Dental. And then you can always go about it and trying to, you know, minimize the interest rate and then go on a payment plan. So it's going to be worth it. And don't be too stressed about the finances. You'll be able to pay back. Just be vigilant. Just be smart about it.
Great, great. Thank you, doctor, for that advice. I kind of want to go back to the scheduling aspect of it. I know that you are still new and you're still getting acclimated to your schedule and your role within the office. But we have a question that just came in regarding flexibility in your schedule. So I kind of want to tweak that a little bit because, you know, you are still kind of new. So what does your schedule, or what is your schedule going to look like working one column opposed to an MCD that works 3 columns? What does that one column schedule typically mean?
So one column schedule typically means that you might get like saturated morning, and then you might get a really easy afternoon. So it really depends on what kind of things are planned out for that day. And when I looked at sample example schedules, I was able to see that you're not constantly every minute you're busy every day. Like, I know that my MCD had an easier afternoon in the morning, like he had root canal therapy fillings, and then in the afternoon just adjustment of dentures and delivering dentures. So like, you will have something to do, but I don't want you to see it as like with unknown fear that they're like, oh, I'm going to be constantly busy now. I don't have time for lunch. I'm gonna be doing back and forth, back and forth. Like, I don't see that happening. And also depends on demographics. For one column, I would say that they will be spaced out. So you have plenty of time to finish the procedure. And also it depends on you. So they will try to go with you. So let's say that like I am booked for 5 fillings for that day. And I'm like, okay, for me, it will take maybe 30 minutes to finish that, like 2 fillings. And I'm like, okay, I want to add another more. And then I look at MCD's column, like, hey, lead dentist, doctor, you know, let's say my lead dentist, Dr. Honda, do you want me to see that patient for you instead of, you know, you trying to squeeze that patient in? Because I think I'll be done earlier. And then okay, sure. Do you want to see that patient? Go ahead. I will assign you that patient. So it really, if you think about flexibility, it really depends on if you want to just take that basic schedule and then you will be able to manage it because you're gonna be given plenty of time per procedure. Or if you are a fast catcher and then you're just like, okay, I wanna go, get going, I wanna produce. Like, I'm like that, maybe because it's Asian in me, I have to like do everything like myself. But like, I really think that there will be reasonable time where you can take your break, you can breathe, you can, you know, take a lunch break. There is always 45-minute lunch break at the Aspen that I was working at. So I don't want you to be worried about the schedule because they will not have you sit like through that grueling schedule every single day, like every column like that. So also it's about open communication. You need to communicate if you see a problem with your speed, you know, something like that. And then also, like, I think it's going to be regular 8 to 3, 8 to 4 every day. And then for me, because I also will be covering Saturday clinic sessions too, because I volunteer to be as well. So they don't expect you to cover all the Saturdays, but I volunteer that, okay, I'm just gonna also work on Saturdays. So it really up to you. If you wanna do more, you can do more. If you wanna keep that basic schedule and then, just keep it easy for a couple of months, you can do that too.
Great, great. So I want to take a step back a little bit here, and this is a question that came in, and I think it's very important, and I think this is a question that every student is interested in. Regarding compensation, without going into any numbers, without going into any specifics, I know that you did your research, but before you went with Aspen, this is something that all students do. They do their research on what else is out there regarding, before they sign on the dotted line, regarding compensation and maybe how a private practice pays opposed to how Aspen Dental pays. So what would be the difference? Like, if you can kind of just touching the surface, like I said, without going into numbers, just kind of basically give an overview on what your compensation structure looks like and how that may differ from maybe a private practice.
So some private practices I was approached for the offers was that they will do based on production. So usually for Maryland location, I would say that they're like 30 to 33% of the production you will get paid. So it depends on the period of the times that they count the production. So let's say that you get paid biweekly, and then they will look at the overall production of the biweekly, and then they will pay you that 33%. And that can be tricky because it's solely based on your production, and then you will feel the pressure to be able to produce for 2 weeks to each end. It depends on the frequency of how much you get paid. And for Aspen, I joined with the good amount of daily guarantee, so that there is a daily guarantee that I will get paid for no matter what kind of procedure I do. But however, there is a compensation setting for me. So if let's say that I am an associate that just stays for one office, like let's say that I'm an associate, I'm gonna stay here without going to any other office to cover their days, then what they will do is that at the end of budget period, they will look at it, and then if this office performed way better than what they budgeted, then you will take some percentage of it as an associate. So like it can be 7%, it can be 10%. So on the top of your daily guarantee, and then you can get over the budget. So let's say that you, one example, let's say that for 1 year budget was 1.2 million, and then our practice pool, let's say 2.5 million, and then you would get maybe like 3 to 7% off that at the end as a bonus. So it really depends on the location in the office, and some private practice will try to do hybrid. So you will start with a daily guarantee, and then they will transition you into the production when you are catching up on your speed. So something that is a lot of method of getting paid and compensated. For me as a new grad, and then me being able to start right away, I didn't feel that confident to be able to handle that production percentage. And I was not in a situation where like, okay, like I don't think I can commit to be able to increase production each location I work in. So the Aspen Dental with daily guarantee, I feel okay, I'm getting paid no matter what, but does not mean that I'm gonna slack on it. I'm gonna do more because I want to chase after that bonus production percentage as a compensation. So like that's the thing, is that it really depends on where you want to go, where you want to work. But for me and for my position with Aspen Dental, there's a daily guarantee. And then you can also always, like as your year goes by with your experience increase, you can always negotiate your daily guarantee as well. So I think it's quite fair with my experience level. And then I'm pretty sure next year or two, I'm going to be able to renegotiate, and then they will try to come up with some new numbers for me. So it really depends on what you want to do. Yeah.
Yeah, I like that you mentioned that the daily guaranteed gives you that security, right? That can kind of be a scary thing for new grads, just wondering how they're going to get paid and if their structure is going to be solely on production. So you mentioned the daily guaranteed plus a percentage of what the office makes as well. So that transitions to our next question regarding location. I know that you just mentioned like where you want to go and things like that. So did you end up in the location that you wanted to be? I know you went to the University of Maryland. You were located in Maryland. If you can kind of just give a brief overview of where you're at now and what was, you know, your decision process look like regarding location.
So I was actually offered to relocate to Pennsylvania by another practice owner, prior to meeting Dr. Gupta, but I was really chasing to stay in Maryland because my mom is a permanent resident here, and I did not want to be too far away from my mom. I have separate apartment because, you know, I want to have my own, like, you know, social lives and everything. So away from my mom, but, you know, but I did not want to be in different state lines. So I really want to stay in Maryland. It worked out really well because I think I got lucky, but I also think I did a good amount of research and talking to people, like who owns these practices, you know, like who is the practice owner in these locations I want to work in, and what kind of things they do. I want to reach out to them. So like, it's easy to find their information on Aspen Dental website. So I wanted to go on like, okay, who's the practice owner in Maryland? And then it was Dr. Gupta. So I was like, okay, I want to meet him. I want to be able to have an interview with him. So actually, like, that worked out well. Like, I got matched with the interview at the Aspen Dental event, and then he sat down with me one-on-one, and then I showed him my portfolio, my resume, and then he liked the fact that I was actually trying to actively get this going. So I'm very happy with the fact that I'm staying in Maryland, and then he owns 23 practices or something. So, and then if I want to go somewhere else within the Maryland office he owns, then he can always put me in there. Like, okay, do you want to cover this demographics? This is geriatrics demographic. Do you want to go to this piece, like semi-piece, like related practice? Like, you want to get more experience, you can cover their services. So it is possible to be flexible with your location. It's just that you have to reach out and get that information and then find the location ahead of time.
Great. I just want to say congratulations for getting, along the location that you wanted to be in, because a lot of students, whether it's with Aspen or with anywhere else, they end up relocating. So it's
also, I want to say, good thing about sometimes relocating is that those relocating that students might be also making a lot of good financial decisions, because that means they really need dentists. And then that means your financial compensation is going to be higher because you're needed there. So it really depends on like the daily guarantee, and everything can vary within the location. So let's say that they're like, I was offered to go up to like a rural Pennsylvania area and I'll get paid like, a couple more $100s more per day. But like, also you kind of have to find a good balance between like, okay, I want to stay in this location, but keep, financially just maybe a little less, but then like, it really depends on what you want to do. And sometimes I recommend some students to go relocate, go explore, go somewhere else, go out of your comfort zone, make some coins if you want, and then learn as much as you can in a high demand. That means you're never going to run out of patients, and then you will get so many clinical experiences. So it really depends on what students want to do. And then I think I sometimes recommend, even my friends are working in Aspen Dental from my class, like, okay, good for you, you're relocating New Hampshire. There's nothing wrong with that. And then, so it's like, so I think that get that information, get the support from the, Miles or other people who are working for Aspen, and then they can try to find you informations.
Yeah, that's great. I want to kind of touch upon your relationship with Dr. Gupta. I know that you said, he owned 3 practices, and I remember telling you this offline that you're in great hands. He's one of the best, greatest owners that we have in the organization. So the perception might be like you may be distant from him, that because he owns 23 offices and you might not be able to get a hold of him, or something like that. So what does your relationship look like with him? Are this door open? Are you able to ask any questions that you want? Or do you feel you have that support from your owner, Dr. Gupta?
Yeah, he's actually the one who opened up the group chat on WhatsApp app. So he added me on it. And then if I have any direct questions to him, then he always responds to my messages. I actually have his personal phone number. I text message him and then he will respond. So he's not like out of touch with everything. I mean, of course, as a, you have to make your own dentistry. So, when you're working, you kind of have to be your own dentist, which I agree with everybody here because that's what the support organization does for us. But you will always have that. I have a really good relationship. I ask him or my operations manager any questions that will get back to me within a day or two. So I never felt like I'm out of touch with him, even though he is a really busy man. He's a very nice and busy man. So I never really felt like, he's just gonna be, okay, you go now, you do your thing. Like, no. Like he actually like answers my questions. And then he actually like trying to direct me to the right people.
That's great. 23 offices. I can imagine how busy he is. Being an owner of 23 offices. Wow. Like that's really goals. One question I have for you, Dr. Shin, is, so you graduated in 2020 of this year and you went to work right away, right? So what was the deciding factor why you didn't do a AEGD or GPR residency? Why did you want to go work right away opposed to going to a residency and honing your craft, getting one more year in to work on specific procedures you're not so comfortable with? Why did you make that decision? Because when I talk to some students, and it's kind of split down the middle, whether they're comfortable enough to go into work right away, or they just want to go to a residency and want to advance their education a little bit more. So when they do get licensed and they do start working, they're as comfortable as they can be. So what led you to that decision on going to work right away?
For me, I looked at my ultimate goal is that I want to become a practice owner. And then for me is that I do not want to go back to academia to teach or anything anytime soon. And the thing about it is the HDGPR, yes, those are like promoted in the dental school because a lot of the, older generation dentists have done them and they will still recommend them. And it's kudos for other students to be able to pursue it and go and then learn more education with the procedures. It's like this, there's a saying, AGDGPR is pretty much like 300 hours worth of C you get paid for 1 year time. And then, yes, it is like a lot of education. You will get a lot of mentorship for 1 year. And then I was like, okay, that's another good route. But for me is that I ultimately want to become practice owner. I want to learn the business as much as I can. And also within that 1 year period, I know I will catch up. Like, I'm not like one of those people that will just settle down and then do just billings and pro fees. Like, I want to be able to learn. And like in my dental school, I was lucky to be enrolled in the honors program to be able to do like dental implant restorations extensively. So I did not feel like I have to go to another program to do that. And also like I was feeling ready, like I was increasing my speed through the externship. So you kind of have to look at yourself and then tell yourself that they're like, okay, this is ultimately what I want to do. And you make that decision. And secondly, when I was looking at Aspen Dental program for associates, I was glad to know that they have mentorship I need. They give me a period of time and they do mini GPR for like 3 months where actually I can like, get training in many different aspects of dentistry. And then I still get paid daily guaranteed. So for me, that just made sense to me. Like, I know that it really depends on people. But like for me, that having that kind of level of understanding and also having the support system that I can get from Aspen Dental, I decided to just shoot my shot and then decided to join. And some of my friends did the same thing too. Like, I mean, they were very academically, like, very like set on, but they also wanted to be a practice owner someday. And then they thought that this route works for them. So I would not be discouraged if you end up not doing GP or HD. You can still find your support system within here, and whatever you want to do, and then pursue it. And I'm very happy about my decision so far.
Yeah, that's great. And I like that you mentioned implant restoration, and that kind of, that we just got a question that came in regarding procedures. So what procedures do you want to learn a little bit more about, or like the ones that you're not so comfortable with? What would those be that maybe the saying keep you up at night, or that you want to take, you want to maybe take some CE or some advanced education, or kind of bounce some ideas off your MCD about, or Dr. Gupta, or whoever it is. What are some of those procedures that you're interested in learning about?
So there are two major procedures I really want to be able to do fluently. One is endodontics, root canal therapy. And then I know that in Aspen Dental as an associate, I will get plenty of C courses on endodontics because they have all the platform I need. And my MCD does pretty much everyday root canal. So like you can always ask your experienced doctor. And then as an associate, you will be able to do bicuspid to bicuspid. And then if you do like molars, you can always get help from the endodontist who also works for Aspen Dental. Another thing is that implant surgery. So that implant surgery is something that you can always get involved in because Aspen has a good relationship with the Nova BioCare. So they will be able to provide seed informations on that. And I know that one of the new MCD works in Philadelphia area. He did an implant trip, and over the several days, he was able to place implants with the guidance from the oral surgeon. So like there are opportunities out there, just that for now, like those two things, I want to be able to have stronger experiences in those two. And that I'm not too concerned about that because I know that I'll be able to learn through my time here.
Great. That's interesting because we just got a question in regarding what do you find most frustrating about dentistry? I know that it's not always, peaches and cream when you go into the office and you're helping patients, and like I said, you are still fairly new, but is there anything that gets you kind of frustrated?
The frustrating part is always going to be the pain management in the patients coming in. And I always had a difficult time with when patient has deep cavity, deep fillings, and then they come back with more sensitivities. And then, sometimes those hard scenarios always frustrates me. And then as I was shadowing and being trained, there are patients coming back with those issues. And then that's the part that is still like for any dentist, like whether you have practiced for decades or you're a new dentist, I think it still frustrates us to be able to handle patients' pain and then getting through their emotional parts and then being able to tell them this is what I think is the best thing for them to do, and they end up not doing them. Sometimes that frustrates me because they're going against, not going against, it's their body, it's their consent. But like sometimes when you're trying to offer what is best for them scientifically with the clinical knowledge you have, sometimes they say like, no, I don't want to do that. Those things like tended to like frustrate me a lot. And even in dental school, and I was shadowing with lead dentists, and like lead dentists tell me like, oh yeah, that is still frustrating part. But at the end of the day, like I think that it's all about learning through that and then being able to manage yourself, and then also leave at that moment. Do not let it affect you throughout the day. Like I always tell myself that like there will be always frustrating cases, there will be some bad thing happening through my career, but I don't want it to affect my whole week. I don't want to let it affect me for the next patient that's coming in. So that's what I learned from the dentist, and then I'm like, okay, that's what I should keep in mind if I see anything frustrating.
Great. So we're coming up on 5 minutes left. I want to get to a couple more questions here that are coming in. So this is an interesting question. So what is one of the most important things that you learn by working in the office versus what was taught to you at school? So University of Maryland compared to working at an Aspen office. What are some of the things that you learned that you you typically didn't learn in school, or maybe that you wish you knew, or that you kind of open your eyes a little bit about? What are some of those things?
So in Aspen Dental, you're never alone. But in dental school, the school will tell you to manage your own patients, manage your schedules alone. You have to set up your patients alone. It's good to have the people that works with you, but also at the same time, that eye-opening thing was from my lead dentist was that you have to be able to manage who you work with and then being able to cooperate with them. So you cannot do this alone. Like I always tell other people, like I think that as a dentist, you're a team. You have a dental assistant, you have a hygienist, you have a manager. So you have to be able to work with other people. And something that I'm still learning and I learned is that through that skills, like people skills, and then conversation, being honest with each other, being able to support each other. I think that's something that I wish dental school was able to teach us more through either scenario or sending us to the externships and going through exercises. But that's something I'm still learning. Is that I'm never alone now. I have people that I have to work with, and I have to be able to work with them well. So that's my answer. Yeah.
Great. That support aspect of it is super, super important. I know that we've gone over this multiple times during this Ask Me Anything session, but that's one point that I really, really want to drive home, and that Dr. Shin can speak to, is that you absolutely have that support, and you have that support system and autonomy, and within your office, especially for a new grad. That's really important. So I'm going to go into this last question that we have, and I think it'll be appropriate to end the session on this one. So what would be your biggest piece of advice for a dental student, whether they're a D1, D2, D3, or D4? What would you say is a golden nugget that you would want to share with all of the students on this call?
So I'll just tell you that there will be a lot of frustrating aspects being in dental school. From since D1 year, D2, D4, there will be always like bumps on the road. But I want you to remember that when you walk that stage, it's all gonna be worth it. Do not get yourself so over little things. Remember to learn as much as you can. And also you're becoming your own doctor. So focus on that. So do not worry about what others are doing. Do not worry about, all the small things that bugs you. Learn as much as you can, trying to become your own doctor. And then don't concern yourself too much about what's gonna be like. There will be moments that click with you, that you will know that you made the right decision. And so that's what I'll just say. I will tell my old self in dental school that they're like, okay, do not get stressed about little things. You will become a dentist. You will get a job. You will have the support you need. So that's what I can tell anyone who's watching this. Just relax. You'll be fine.
Great. And I think that's a great note to end on. Thank you, Dr. Shin, so much for your time and your answers. And if any of the students have any additional questions, please feel free to email me, miles.murphy@aspendental.com. If you have any questions for Dr. Shin, please reach out to me as well. I will be happy to connect you with him. Want to thank all the students, want to thank Dr. Shin. I think this was very, very informative, and I really enjoyed connecting with you, Doctor. And good luck next week.
Yeah.
Finally beginning your professional journey. I can't wait to hear all about it. And thank you, everyone, and have a great night.
Thank you.
Bye, everyone.